survey of BAME NHS workers by ITV News found that 50% felt that discrimination in the NHS played a part in the disproportionate deaths among BAME staff. Of the hundreds of trusts, the number of chief executives who are BAME is still in the single digits. 6 years on from the Snowy Peaks report, why has more progress not been made?
Well, the first thing to say is I think I agree with your underlying point, which is that the NHS is both part of the problem and part of the solution. And we have certainly, as a result of something called the Workforce Race Equality Standard, now begun tracking at every trust the experience of Black, Asian and minority ethnic staff compared with white and other staff groups. And we have seen demonstrable progress in terms of some of the core HR measures, if you like, of fairness at work, in terms of the likelihood of being shortlisted for promotion, access to training, ending up in a formal disciplinary. We've also seen a 30% increase in the number of Black, Asian and minority ethnic, very senior managers across the system. And in parts of the country, such as London, where we had a indefensible position where a large number of trust boards did not have a BAME non-executive, that has now changed in every organisation across the capital. But nobody thinks that is good enough. I certainly don't. And that is why every part of the NHS has been asked to set measurable quantitative goals for improving diversity at all levels through the organisation. That's something we're doing at NHS England and NHS Improvement as well. And because you can't separate the workforce experience from the patient and community experience, we are also, with the NHS Confederation, now funding an independent race and health observatory, which will generate not only actionable information, but also catalyse some of the wider changes that are needed in the way in which we offer services to communities, different community groups. For example, the type of work that Professor Jacqueline Dunkley-Bent, our Chief Midwifery Officer, has been leading with Black mums and access to maternity services. So this is a huge change programme that is needed across the NHS, and we do not dissent from that.